The Health and Wellness Ministry on Monday signed an agreement with private facilities that will act as access points for the Vaccination Implementation program. These entities will provide additional sites for members of the public to be vaccinated.
Jamaica is set to achieve its target of administering 700,000 doses of the COVID-19 vaccine by the end of September. However, this is just one milestone in the journey towards herd immunity against COVID-19. Minister of Health and Wellness Dr. Christopher Tufton says expanding vaccination access points in partnership with the private sector is key to achieving the goal of 65% of the population getting vaccinated against the coronavirus.
Today we have probably 7 to 8% of our population fully vaccinated, another 17 or 18% with at least one dose, and over 700,000 jabs delivered in the arms of Jamaicans. And that represents progress, but clearly the ideal scenario would be to have achieved the 65% if we could. Theoretically, we would have loved to achieve it 3 months ago, but practically all the obstacles that I have outlined and that you know about have brought us to this point.
Invitations were sent to the private sector through requests for quotation for their participation in the initiative. The RFQ is aimed at small, medium, and large enterprises.
That in terms of outlets, hospitals, pharmacies, larger established medical centers, they all qualify as long as the protocols are followed. Because ultimately, our job is to protect the health and wellness of people. And we have to always balance the need to inoculate and to meet targets and to be timely and be efficient with the need and the role that we have to maintain the standards and the qualities that are needed.
Dr. Tufton says the ministry has received a number of proposals and 11 entities have been selected.
We're very proud of the team that is here, the persons, the entities that have been selected. We believe that they are very qualified, technically and otherwise, to be a part of this process, and we are happy to partner with them, of course, in a way that allows the public health infrastructure, the public health technocrats to provide some oversight to ensure standards are maintained, but nevertheless giving these entities the autonomy sufficient to inoculate. It's a simple process. We provide the vaccines free. They promote. We will help them to promote themselves, their locations. People go there or make appointments and they get their vaccination.
The Health and Wellness Minister says AstraZeneca and Johnson & Johnson COVID-19 vaccines will be available at the following locations:
the Vein Centers of Jamaica, Lady Musgrave Road, Health Plus Associates, Boulevard Supercenter in Kingston, Online Medics, Greater Portmore St. Catherine, Fontana Limited with locations in Mandeville, Montego Bay, Kingston, Ocho Rios, and Savlamar. I didn't know you had so many outlets, but okay. Portmore Health Complex, Henderson Drive in Portmore, Windsor Wellness Center, Windsor Avenue, Kingston, Bay West Wellness Hospital, Bay West Shopping Center, Montego Bay, Winchester Surgical and Medical Institute, Winchester Labs at Winchester Road, Kingston, Hospiten, which is at the Half Moon Complex in Montego Bay, Medical Associates, Tangerine Place, Kingston, the private practice of Dr. Michelle Holt, okay, not all medical center, Caledonia Avenue, so that's not all hospital, I'm assuming.
Just before signing the public-private partnership agreement with the entities, Dr. Tufton explained that the vaccines will be offered free of cost.